Hi, my name is Alicia Loken, and I am a nursing professor at Bakersfield College, and I was part of the Clear Action Research Fellowship and did a small study this semester, and I compared a flipped classroom to a traditional classroom in improving clinical judgment among nursing students, pre-licensure nursing students. So, background. We found that new graduate nurses lack the clinical judgment that they need to meet complex patients' needs. So, as patients become more complex in the clinical setting, our new graduate nurses are not able to meet those needs. The traditional licensure exam for registered nurses didn't really adequately evaluate their ability to exercise clinical judgment. So, the organization that develops the licensing exam has changed the exam. They call the new one the next generation nursing exam, basically. So the next gen is meant to measure a nurse applicant's ability to utilize clinical judgment. So the problem is that then changes what we need to do in the classroom when we're teaching nursing students. We need to be able to teach them to use clinical judgment. So even in a classroom setting, we need to bring clinic into the classroom. And all of that makes sense, right? We don't want to have nurses who are great at taking multiple choice tests, but are terrible at actually taking care of people in the clinical setting, because that's what our job is. So it all makes sense. But as a nursing instructor, I need to find a way to go ahead and teach the students in a different way so that we're constantly reinforcing clinical judgment. One way to do that is to use learner-centered teaching strategies or more active teaching strategies as opposed to traditional strategies such as lecture. So the purpose of this study was to compare a flipped classroom, which is one active teaching strategy, with a traditional lecture classroom, and to kind of compare how they did at promoting clinical judgment in the students. So this was a pre-test, post-test randomized control study. I created an exam that measured all elements of clinical judgment as measured on the new NCLEX, or the new licensing exam. And then the students were broken into two groups, and they were broken into these groups randomly before their first semester of nursing school. So cohort A is a control group, and they received a lecture on burn assessment and management, kind of traditional classroom lecture. Cohort B was the experimental group. That was my classroom. And I gave the same information, the same content on burn assessment and management, but I used a flipped classroom modality to do that. And that included pre-class work, such as watching little mini lectures and doing the reading. They did in-class work, which was active learning. It was a case study. And then after class, they watched a little video where I tried to clarify the muddiest points. They identified what the muddiest points were in class, and then I made a little 10-minute lecture for them to watch afterwards to clarify. And then they took the exam before to get kind of a baseline, and then they took the same exam, the same post-test after, both the experimental and the control groups. So what I was hoping to measure was, I was thinking the pretest results were going to be the same in both groups, are very similar because the groups were homogeneous. And then the post-test group, the post-test exams, I was really looking to see, were the post-tests for the experimental group higher, like aggregate and in each element of the clinical judgment, were they higher than in the control group, the lecture group? What actually happened was that my pretest scores for my experimental group were higher, probably related to the fact that they had different instructors in their first and second semesters of nursing school, and now I was doing this experiment in their third semester, but they started a little bit higher. Post-test, the experimental group was also higher, and they were higher in all elements. So in the pretest, they were higher in the aggregate in a couple elements of clinical judgment. In the post-test, the experimental group was higher in all elements of clinical judgment and the aggregate. The flaw in my research was that I didn't do matched pairs. So when I found that my pretest scores were not equal in both groups, I wasn't able to do matched pairs to see if the increase in clinical judgment or the increase in scores in an individual student in the experimental group was higher than the increase in the control group. So that's an area for further study. So conclusions were mean aggregate scores of the experimental group were higher than the mean aggregate scores of the control group in all areas of clinical judgment, including the aggregate score in the post-test. So after getting the flipped classroom instead of getting the traditional classroom. So the flipped classroom pedagogy was an effective means of improving clinical judgment in pre-licensure nursing students, but further study is needed to determine if effectiveness of flipped classroom versus traditional lecture format, to determine if it's more effective in improving clinical judgment. And again, that was because of my mixed pairs issue. Here are some references if you're interested in reading more about a flipped classroom, and I want to say thank you very much.